Good afternoon. My name is Tammy Ellis. I'm a Master's of Social Work, or I have a Master's in Social Work. I'm currently a therapist in addiction and recovery services up in Ogden. I'm also receiving specialized training in sexuality education and sex therapy at the University of Michigan. I'm also going to go the old-fashioned way and use note cards. First of all, I want to say that I think bishops have good intentions. I think their intentions are not to harm but to help. Unfortunately, that doesn't always go the way we'd like it to. As Mormons, we're often proud of the fact that we have a lay ministry, and I have to acknowledge that there are some benefits to that, including many opportunities to serve, but there are also some drawbacks, and I have to acknowledge those. I'm going to give you some examples. So first of all, there's a lack of pastoral care training, so that makes it more likely that a bishop may kind of venture into territory that is probably not his territory, such as the doctor or the therapist making diagnoses, and diagnoses are labels. Those can harm people, so we have to be very careful about that. Even as therapists, we know that it can be very harmful to diagnose someone. Also, instead of being a shepherd, sometimes bishops take the approach of probation officer. They're going to check on you and see what you're doing. They're going to ask you questions that maybe they should not. Third, there's a lack of trauma-informed training. And fourth, a lack of pastoral care training outside of the handbook. I'm going to talk a little bit more about the lack of trauma-informed training and care. So what is trauma-informed care? An organization that is trauma-informed will realize, recognize, respond, and resist. That means it will realize the widespread impact of trauma. It will recognize signs and symptoms of trauma. It will respond by fully integrating knowledge of trauma into policies when working with members of that organization. And it seeks to resist re-traumatizing individuals. A trauma-informed approach does not mean that there will be interventions made. That would be my job or Tara's job. As therapists, that's what we do. Because bishops are not trained to assess for trauma, they may unintentionally re-traumatize a person. So this is happening to some of the victims in the church, victims of sexual assault and sexual abuse. Sam had put out 29 questions that were asked by bishops, and I was told I had to be careful with the language I used, even though it's appropriate. Children are here, so I'm going to change it a little bit. But one of the questions that was given to a rape victim by bishops, or a bishop at least, was, did you have an arousal response to your rape or to your sexual abuse? This implies that the person enjoyed what was happening, and it basically says that the person was not raped, that they were complicit in that behavior. Anyone who is trained in trauma-informed care or in sexuality would know that it's not uncommon to, even during times of rape or sexual abuse, to have an arousal response. And so I think it's pretty obvious that by asking that question, it could potentially re-traumatize the victim. So let's talk about what a victim may experience. Many of the symptoms include shame, anxiety, suicidal ideation, and depression. Shame versus guilt. Guilt is a behavior. I did something bad. I need to fix that. Shame is an identity. I am bad. And that's something we want to avoid as much as possible. Is this what we want at church? Is this what we want our members to feel? I don't think so. So let's let the doctors be doctors. Let's let the therapists be therapists. Let's let the probation officers be probation officers. And let's let the bishops be our shepherds. Thank you.